Welcome to Your Anxious Child, 5-Minute Solutions, a podcast dedicated to providing practical advice and support for parents of anxious children. This advice is informational in nature and not a substitute for a consultation with a licensed mental health professional. And now, here's your host, Dr. Edward Plimpton.
Welcome back to Your Anxious Child, 5-Minute Solutions and Interviews with Experts. Hypnosis is something we all have, I think, a vague kind of understanding of. But it turns out to be an incredibly useful tool in helping anxious children and in a whole range of kind of pediatric challenges that our young children can encounter. Today, we have a very accomplished pediatrician in my local area, Dr. David Gottsegen, who has just written a book, Mending the Body with the Mind, harnessing kids' superpowers to heal and to stay healthy. So, David, thank you so much for carving out the time to talk to us. And before we launch into your book, I wonder if you could just tell us a little bit about you and how you came to write this book.
Well, I'm a pediatrician, and I've been practicing for 40 years. I am retired now, though still the Chicopee school doc and doing some consultations and writing and so forth, a little teaching. But I always loved English. I was a double major in English and biology. I love the power of words. I wrote for this college paper. I went to a special program during med school run by the American Academy of Science for science writers. I got to write for the Milwaukee Journal. I originally went into family practice, however. I'm interested in a lot of things. But I originally went into family practice. I wanted to be one of those docs who could go to small towns anywhere in America or even internationally and volunteer. And I went up to Duluth, Minnesota, which was a terrific program. I did 100 deliveries in the first year that I was there. But then I decided I wanted to specialize in pediatrics, especially behavior and development. Among my other interests, I was also very interested in psychology and human behavior. I thought of becoming a therapist as well. Thought of becoming a teacher at one point, which is part of what doctors should be doing every day. You should be teachers. So I transferred to the University of Minnesota, St. Paul, Minneapolis, in the Twin Cities. And just so happens my mentors there were Dan Cohen and Karen Olness, who were really the leaders, the two leaders in pediatric hypnosis. They wrote the textbook, I think it still is, on clinical hypnosis and hypnotherapy with children and adolescents, now in its 5th edition. So I got to see them at work in this house near the main campus and the huge hospital. I mean, it was tertiary, quaternary care. We took care of liver transplant patients and bone marrow transplant patients and all that stuff. But they were working out of this house and they got, patients with all kinds of conditions, headaches, stomach aches, tics, bedwetting, and they weren't, their problems weren't resolving. And they taught these kids clinical hypnosis. I say teach because Dan has a saying, all hypnosis is self-hypnosis, that teach them how to access the powers of their mind to help themselves. And I thought it was pretty amazing. So
what is hypnosis?
Okay. Well, according to the American Psychological Association, I think it's pretty accurate. Hypnosis is a procedure where trance, which is a state of heightened focus, is along with the use of imagination and suggestion. Those 3 factors are harnessed to reach a clinical goal. And that's where I think clinical hypnosis is kind of separates itself from, say, meditation, which I do and I'm a big believer in, and I taught kids how to do it, where there you're more or less mindfully breathing and let the thoughts come and let them go. With clinical hypnosis, a lot of the very same stuff, but you're using the same techniques to help, say, overcome headaches or overcome stomach aches or overcome nightmares or overcome tics, for example. So yeah, so that's what hypnosis is. A lot of people have the misconception, and I faced it with patients occasionally, that it's some kind of mind control. And it's quite the opposite. It actually, I feel, is more permissive than many of your your guided meditations or guided mental imagery is. Because what do you have when you have guided mental imagery? You have a therapist or one of the leaders in the field. I've heard lots and lots of recordings. Okay, take some deep breaths. Now imagine yourself, you're at sea and you're floating along, and then you're diving up and down like a dolphin, and then see those clouds overhead, smell the salt air, do this, do that. You're actually being told what to imagine. With clinical hypnosis, what you do, and this is what clinical hypnosis is as separated from stage hypnosis, which I think is done by charlatans, in my opinion. Clinical hypnosis, the client or patient gets to choose. You, as a clinician, need to find out what their interests are. Do you like going to the beach? Some kids don't. Maybe they'd like to go to the mountains or somewhere else. And then we check in. We say, could you tell us where you are? Can part of your mind, your part of your mind that's here right now, tell me what you're doing? And then I find out that they're not at the beach or the mountain. The young person has decided to go to their own bedroom, which is their most relaxing place. So they decide. They're in the driver's seat. And my role as a clinician is just to help them get over, to resolve the problem that's most important to them.
So one of the things I found quite interesting about your book was that it was really an invitation for parents and medical providers to begin thinking about how we can kind of harness the power of a child's imagination to deal with a variety of kind of problems. And um, I think it would kind of be helpful for our audience if you could give us some illustrations of how you've been able to kind of use that. Um, for I'm not sure what the best example might be, but I guess in a pediatric office, perhaps a problem of intractable pain or something like that, or some version of that. Could you? Would that be a fair um,
Mhm.
um, way to kind of illustrate what you're trying to get people to think about?
Yeah. Um, so one thing I was going to say just in passing that we any parent who's observant, and I start in chapter 2 with my little granddaughter, we use their imagination to help them resolve problems all the time. Little Emmy is running around pretending to be a superhero. She wants to have Cheerios. Her mom says, it's too close to dinner, Emmy. She cries, but then she has her little dolly with her. And Jessie, my daughter, saw her, and I was there talking to her and like going, no, no, you can't. It's too close to dinner now. So
Uh
kids
huh.
resolve their own problems by talking early on, and you know this as a child psychologist, by talking to their imaginary friends or their dollies. So they're all the time already using it. It's just my role if they're older, to help them reharness that amazing superpower, and then focus it. In the case of okay.
That was a glitch.
Oh, okay. So in the case of headaches, for example, I could think of many cases, but typically, let's say a child has I'm thinking of a little girl. She was um, Puerto Rican. And her parents were from Puerto Rico, like about a third of our patients at Holyoke Pediatrics. And people have asked me, oh, gee, all this alternative medicine stuff is great for us people, for folks in Amherst, in the Valley who are used to meditation, yoga. How is it down there in Holyoke? And I say, it's better. It works great because I learned so much from my patients that the folks like from Puerto Rico are totally into their mind and body. They know there's no separation. They're smarter than doctors,
Mhm.
many of them. So anyway, I was teaching her. She said, well, first, of course, like any doctor, I want to make sure it's nothing serious. Now, if I've sent a consultation. Usually they've seen neurologists already, maybe had CAT scans or MRIs, but I always, if I'm seeing the first time, want to go through a careful history and physical, make sure it's not a brain tumor, for example, those rare, horrible things. And then I ask about lifestyle. I find many times with kids with headaches, they were, I think this kid too, had seen a neurologist, put on a pill, but I find out she's only sleeping like 6 hours a night and having a hot pocket for breakfast. Well, you can't get over anything unless you have a decent diet. And, those simple lifestyle things are just like the low-hanging fruit. I mean, but so many people just don't even ask. So we talk about stresses at home. What could be triggering the headaches? Is it something at school? Is it a bully? Is it something going on at home? So we go through all this. And then this little girl, no, she was okay. She was anxious sometimes, but her parents struggled a bit to pay the bills, but she was doing okay. So then we said, I asked her to define it. She had classic migraines where she actually had hemicrania, where she saw flashing lights, and then half of her face, she saw visual scotomata flash. This she saw it out of one side of her head. I have her draw pictures. So drawing pictures I use with kids with headaches, stomach aches, and bedwetting. Not all the time. And if kids say, I hate to draw, I won't do it. But for example, neurologists found out 25 years ago, there was research where neurologists were able to diagnose migraines by looking at their patients' drawings. Then pediatric neurologists found they could do the same thing. Well, then the next step was for me and colleagues like me were to use the drawings not only for diagnosis, but treatment. So they would draw this girl drew lightning bolts coming out of her head. She drew an actual crack down the side of her face, and her eye was distorted. Very good picture. I think I have that in my book. I have some kids' drawings. And I said, so how are you like, when you get the headaches, what do you feel like? And she says, oh, I feel nervous. I feel nauseous. It's awful. I have to sit in a dark room. And then I ask, what do you like when you get better? And then she drew another picture of herself smiling. She says, oh, I play with my puppies. I draw pictures. I write poems. This is so lovely. I think she was about 10 years old. And I said, well, how can we get from there to there? So then we talk about relaxation breathing. In the case of headaches, this is something that kids or adults need to do every day because it typically, clinical hypnosis and biofeedback and CBT, which I'm sure you're the expert in, works best when it's done every day. You can't just do it when you get the headache. Then you have to take perhaps the ibuprofen or whatever. But do this every day. Your relaxation space, feel yourself breathing, feel your muscles loosening. I try not to use the word relax because many times kids have been told over and over, why don't you just relax already? You're too tense. No, words like warming, loosening, heavy, those are words that we use. And then imagine yourself playing with your puppies and writing your poems when things get better. And so that's a large part of the healing process, and that's how she can use her imagination in that case. And she did get better. And her mother, who was sitting in the room, also got migraines, because half of all kids who get migraines, put it this way, 40%, if one parent gets migraines, 40% chance the child will get it. If both parents get migraines, 70% chance the child will get it. It's similar to allergies, actually. So the mother or father sitting in the room, or grandparent, who, if they get headaches, I said, you could join in, because the parents, except for older teens, they're usually in the room. I say, feel free to join in. Close your eyes if you'd like. And half the time I see them very relaxed as well. So,
Um, just to back up, people have been able to kind of diagnose migraines by just the drawings that children draw.
uh, yeah, I mean, it's not used as a sole diagnostic criteria, but it's
Right,
very
but of
helpful.
course,
Starting with adults, because you see these lightning bolts, especially at one side of the head. If I see, tension headaches, which are the other major kind of headaches, are more like a tight band around your head. So kids will draw that. They'll draw a tight band around their head, versus migraines, it feels pounding. So they'll often draw hammers like that, or lightning bolts. Um, uh, that kind of thing. Yeah. And they'll draw like distorted pictures of what they're seeing. They may actually see things in a distorted way. So it's often very helpful.
it sounds kind of rather lovely. And then in your hands, to have them draw a picture of their migraine, and then draw them doing something that they enjoy and stuff like that, and then asking them how they
Specifically
get.
when the headache's better. Yeah.
Yeah,
Yeah.
well, um, that it sounds rather lovely, actually. Uh,
It's very fun. Yeah, it is. It is.
um, and that is something you would actually call hypnosis.
Yeah, because it's utilizing trance. They don't need to close their eyes. Most kids under 9 don't want to, but they're in a relaxed space. Um, they're utilizing focus. They're focusing on my words. I'll often make recordings for them to help them practice at home. And I'm giving suggestions. And there might even be what you'd call a post-hypnotic suggestion. Now, one of my teachers, Michael Yapko, um, framed it. I took some master workshops with him as, whenever X happens, you will think Y. Most people, when they think of post-hypnotic suggestions, if they've been on one of these hypnosis shows, will be, you know, whenever you whenever someone says the word lilac, you will just collapse on the floor, or something. And then he'll do it after the show, and someone will just go, okay. And that's mostly the subject's acting, so they could be part of the act. What we'll say is, whenever you're in a spot, let's say they might get their migraines. Well, let's say it's a young teen girl when they get their period or something, or they might get it at math class, which is stressful. Say, whenever you're at math class, you can especially think about being at your place where you're completely comfortable. So when you're at X, think Y, and that's kind of the quote post hypnotic suggestion for them. And then remember to practice, and then they could re-alert, and just come back to your usual space right here.
You're It's a suggestion, but it's also giving them permission.
Mm-hmm. Exactly.
Um,
It's giving them permission to use.
As you're talking, David, there's another kind of quality that I'm kind of struck with before we go on to some other examples, which is the way you're kind of talking about things. You're slowing things down. And I certainly kind of find that kind of, parents come in and or the child, and they're caught up with the urgency of the situation. Certainly parents, whenever there's problems, there's kind of an urgency of we've got to do something. Um, and and what you're doing, and just by your voice and how you're proceeding, it seems like you're really slowing things down.
Yeah, I think in this fast-paced world, everybody's in yeah, in a hurry, and then they miss things. There's another girl I talk about it briefly, and I have these Instagram and Facebook posts, and I talk about it on my Instagram, Facebook post. One of them last week, I think, or just came out, and it was a girl who had chronic pain in her big toe, which began after an injury in soccer, and she got it. Anyway, I think it was soccer. Maybe it was basketball. Anyway, she
I,
came in with this
no, it's soccer. It was soccer. I remember
soccer,
from your
yeah,
book.
so yeah, and it was just hurting, and, she was actually seeing a therapist because she was so upset about not being able to play the sport she loved and so on, and she was a very nice, that sort of type A girl, really wanted to do her best, be and it was more of a struggle when she reached high school, and we talked about that, but basically hurt her toe, and she had, gone to Boston Children's, and again, like you said, a need to do something. Even though you and they didn't want to tell her it's all in her head because I believe that nothing's all in the head or in the body, virtually nothing. That's why the main problem with so many people in the medical field, you have to, you know, it's all in your head, then you need to see a psychologist like yourself or a therapist. All in the body, we'll find on some tests. So they kept doing one test after another. The x-ray was normal, the MRI was normal, even checking bone density. And then they argued what kind of particular pain syndrome it could be. Oh, it could be this, but she didn't have allodynia, which is when you just brush the surface of the skin, it hurts. She didn't have that, so it couldn't be something called reflex sympathetic dystrophy, which is called by something else now. And so what I just did is I listened to her carefully, and I just said, "It just seems like isn't this it's funny this should happen after basically all you did is stub your toe." And then I said in a very understanding way, not making fun of her, and she kind of smiled. And then we did some relaxation mental imagery, but she told me at the next visit that was really the start of it getting better. I just like hit something, and I think she knew, I knew they weren't going to find anything. It was just a mysterious link between her mind and body because that's how chronic pain works. It's certainly true and known to be true for irritable bowel in adults and kids that you suffer pain. There's real injury to the nerve ending, but then the injury resolves. The injury is healed, but the nerve keeps firing just like a false alarm sent to a fire station, or just like cars like used to diesel. The engine wouldn't turn off, or as Neil Schechter calls it, and at Boston Children's Pain Clinic, it's a software problem. And Rachel Coakley, she wrote a great book on chronic pain. She's a psychologist. It's a software problem, not a hardware problem. So you can't see anything on tests, but the nerve endings keep sending that signal of pain for some reason. And it's just how to get over that. So that's what we did with that girl. After several sessions, she was returning to her sport. Yeah.
Yeah, so the brain, um, and act as always, getting false alarms, and no matter where the source of the pain is, it feels the same.
Right. I mean, even if the limb is actually, we've known for a long time about phantom limb pain. People who have amputations of arms or legs, it can hurt in that hand, even though the hand is gone. It's just nerve sending signals, So.
Reminds me of that man in Britain who was working at a construction site and a nail went through his foot. And he was screaming in pain all the way to the emergency room. And when they were finally able to take off the boot, they found that it had gone in between his toes. It had actually not punctured his foot. And as soon as that happened, his pain went away.
So he was imagining, he was saying, oh, it must be in my foot.
Right.
And his brain created the pain.
Right. So
when Dan Cohen used to like to say, although he didn't originate this saying, but the reign of pain lies mainly in the brain.
Oh my goodness. I would be curious as to whether you've been able to kind of use hypnosis to help children prepare for any variety of kind of medical procedures. And I'm interested in that because programs that help children prepare for these things, child life programs, unfortunately, the funding for these very valuable programs have been cut. And so a lot of children are going into procedures without adequate preparation. And I'm just wondering whether more attention to hypnosis might help fill in the gaps a little bit, and whether you have experience helping children in this domain with hypnosis.
You asked me on just the right day because my little granddaughter Emmy just went in to have her tubes removed from her ears. They didn't fall out after 2 years, so they had to remove them and put little patches on her eardrums. So at Mass Eye and Ear. So yeah. So and I kind of gave some suggestions to her parents, my daughter and son-in-law. But anyway, yeah, I've worked with child life folks. I think they're great, and to the extent they've been cut, that's terrible news. I taught at the New England Child Life annual meeting a couple of years ago. But anyway, yes, there's lots of things we can do, and I have a chapter on it in the book. First of all, I talk about the usual things, or just common sense things, to meet with the doctor, the surgeon, the anesthesiologist first, to, if you can, to bring your child to where they're going to have the surgery, if it's not emergency, just so they could see what it's like, to let them know what it's like. And then there's things like actually using guided imagery. I'd call it guided imagery, where, for example, I worked with the ENT folks at Bay State some years back, where we took a group of kids about to have their tonsils and adenoids out. And this has been done in other places too and published, where I talked to them, depending on, I would adjust the story according to how young they were. If they're real little kids, I might just tell a story about somebody who had this happen to them, Daniel the tiger or something. But for older kids, I would say you can imagine yourself there in going into the operating room. You'll be sleeping. The doctor is very skilled at what she or he is doing. And then when you come to in the recovery room, you may have some queasy feelings in your stomach, but that's okay. You'll start to feel hungry quicker than you ever thought was possible. You may have some itching at the site of the surgery, or pain, or some discomfort, but that's just a sign of your body starting to heal itself already. And those little little beeping sounds can remind you that your body's going to be healing itself. And you could tell your blood vessels to clamp right down so you needn't have any bleeding. Um, and you could imagine yourself, feeling hungry very quickly and healing without difficulty. And it's also good. I didn't make this up. There was a great book written called Having a Better Surgery, that was in the waiting room at the pre-op from my wife. She had a kidney transplant. Um, I'm blanking on her name. Peggy Huddleston. She was a nurse and a chaplain, wrote this great book for adults. Part of it is having the surgeon and the anesthesiologist say positive affirmations, like because they're part of a person's consciousness uh, is there in the room, even if they're under general anesthesia. So they're picking up things. There was this case. Where a woman later sued doctors after surgery because they were commenting on her being obese, fat, while she was under, but she heard this and recognized it. So you have them give positive affirmations even when the child is under anesthesia, and then if you make a recording, they can listen to it in the recovery room too. And we found with this group of kids having tonsillectomies and adenoidectomies, they had far fewer side effects. No one had a rebleeding or had to go back to the ER. Within the 2 weeks after surgery, they needed less pain meds and so on. And this goes along with other published studies for not only tonsillectomies and adenoidectomies, but all kinds of surgery. In childhood scoliosis surgery, pectus. I use that with kids with the pectus, where they fix a pectus where the sternum caves in, for kids and adults with burns, um, for all kinds of surgery, and for dental work too.
As I'm listening to you, I think one of the things I'm struck with is the delivery of what you're just saying, because, um, in a way, there are books written for children that describe just what you said. But, there's a big difference between a book and what you just kind of delivered in terms of the pacing, the timing of the words, um, that create a whole different experience. And I wonder if, that rings true to you, or whether you have some kind of thoughts about that.
Yeah, I think what we do is it's a little different. Is we use we use that as kind of a suggestion. When you hear the little beeping of the machine, that could be a reminder of how well your body can heal itself.
Mhm.
Um, or you're giving the suggestion that the surgeon is really good at what she or he does. Um, and your body will do its part by really helping to heal, which is actually true. I mean, uh, the surgeon cuts and sews and sets the splints and everything, but then your body has to heal itself after. So you're just saying what's true. You're just saying it in a way that they can take it in and use their mind to help with healing.
Mhm.
Um, yeah. And you're using the space around him, like the lights of the OR. You can use the smells they may smell, and so forth.
One area of kind of pediatrics that is under siege is the whole issue of vaccinations. And um, and I happen to know, obviously, since we're both in the kind of same geographic, that you are really one of the kind of leading experts, in the area in terms of helping children overcome fear of vaccinations, and helping them tolerate things like blood draws. Um, and there's several parts. I wonder if you could just, talk about how you approach, helping children and also their parents um, tolerate getting vaccinations, and just your thoughts about vaccinations in general.
Okay, well, this comes up because for the decades I've been in this, I naturally have attracted some parents who are alternative, and I say I'm very supportive of all kinds of alternative care. If they see their chiropractor, if they, if they see an acupuncturist, I'm a big supporter of acupuncture. But I say I am pro. I'm pro vaccine. I am pro shots. I follow all the recommendations. I know that it's well supported by science. No, they don't cause autism, none of this. But, you know, kids are naturally afraid of needles. Many adults are. They found up to 30% of adults are needle phobic. And what happens with them? Well, they don't go to the doctor. And so then maybe they don't get their diabetes or their hypertension or their cancer diagnosed. So this is really great preventative medicine, I think, by teaching kids without getting them held down by parents. I think that's barbaric. And I was just like talking into the wind for many years until in my former group, a younger crew came on board in their 40s, and they were supportive of what I was saying. We formed a comfort committee. I believe there's one in Northampton area pediatrics too, where we made rules that, with very rare exceptions, no child who is too big to sit on their parent's lap should be held down for shots. It's just not worth it, And they develop PTSD for shots. So even babies should be on their mother's laps. Um, if For children who get their shots, there are many things we can do to help them. A colleague and friend of mine, a child psychologist, started a foundation called the Meg Foundation for Pain, uh, run by Jody Thomas. Wonderful group. They come up with comfort plans for kids to help them. And, they can choose to sit on parents' lap or not, look at the shot or not, to um, to use a screen to distract with a video game, or use something called Buzzy the Bee, which um, is a little device developed by an anesthesiologist and ear doctor that has frozen wings you keep in the freezer and also vibrates. And that combination blocks nerve signals. So you put it here first to numb the site. And then during the vaccine, you put it up here. And that kind of blocks the ascending signals. I like to call it vaccine or pokes instead of shots. So the use of language is important. Getting the parents on board and never saying this will never hurt. This won't hurt, or not, but not saying this will hurt like hell. Saying it's different for everyone, which is just true. It may feel sharp, it may feel pressure, it may feel scratchy. It's different for everyone. And then for 4-year-olds, I use a protocol developed by a colleague, Ralph Berberich. It was in the Journal of Pediatrics like 20 years ago, where I show them how the alcohol it's cold. So what happens with cold? That can numb you so you don't feel it as much. So positive suggestion. And then I say it might feel like this, and I use a little Q-tip, the sharp end, and then I break it in two, and then or the cotton end, which is very soft, or it may feel like this, and I use the stubby end. And then I say, third thing, while we're getting ready for the vaccine, and I've usually, if the child needs 2 or 3, I'd give it at the same time as the nurse. The parent would rub the child's shin from knee to the ankle and really rub it hard, I tell them, while we're prepping. And when we're about to give it, reach the ankle, and I have the child yell ankle. So they're focusing on that. And then I say, I don't surprise them. I say, we'll give the vaccine when you yell ankle. 95% of the time, the child doesn't cry. And I've done it even with kids on the spectrum, all kinds of kids. It's really helpful. So those are some examples I use to help these pokes go better.
So when you're about to give when the child reaches, is the child reaching down for the ankle, or is the parent?
The parent is rubbing
Okay.
the ankle.
Okay. And so when they reach there, the child yells out, uh, yells out ankle, and then you give the shot or the
Yeah,
poke.
ankle, or if it's Spanish, tobilla, and yeah, and the parent is rubbing it with their knuckle. I say rub fairly hard. The harder, the better, And it's for like the 4-year-old set seems to work pretty well. Younger than that, everything has to be adjusted to developmental age. Um, so yeah, sometimes just counting the number of Amy Baxter, the anesthesiologist, who she's had TED Talks and so forth. She developed Buzzy the Bee. She sometimes suggests counting the letters of the alphabet that have holes in them. The kids say, "Oh, let's see," and then we'll give the vaccine. So something to focusing on something else.
It's interesting that this should be particularly effective with a particular age group, and it's 4-year-olds.
It seems that way. Sometimes
Yeah.
3, sometimes 5-year-olds. Older the older set may like something a little more sophisticated. Actually, that's the age as you get a little older that the shot blocker starts becoming affect that particular device. My nurse had a great way of explaining. She said, we're gathering for a little older child. We're gathering some evidence here. It's kind of like an experiment. We're seeing how this works for kids. Would you tell us how this works out for you? And what the shot blocker is simply, it's very inexpensive. It's a rubber flat piece with lots and lots of little stubby plastic needles. So they don't hurt, but they're, a little bit sharp, a little stubby. And it's put around where the shot's going. And there's like, I don't know, 40 of them. And she said, "Can you tell me how this works for you?" Some kids feel it, but a lot of kids don't even really feel the shot very much. So she gets the kids to be, fellow researchers in an experiment. Like, that's great for like the preteen or teenager, and so that works very well for many of them, for example, using that shot blocker in that way.
Now, for a variety of reasons, we're going to get some children for whom those nice procedures don't work. And I wonder whether there's any way in which kind of hypnosis might help them overcome this barrier.
Okay, so first I want to say, like, this happens when I do procedure or something, when I used to sew up lacerations and take out splinters and stuff. Some kids and adults just don't want to be distracted. They want to be in the spot, and they may be quite upset. "No, I want to look at that shot. I want to just," and you know what? I'm just going to scream really, "Okay." And then they say, we give the shot, and I say, "What good strong lungs you have, and good job for staying still." Because as you know, the trauma is like malleable in the first short time after it occurs. So if you reframe it right away, that's why I would often have a popsicle in my back pocket to give to a kid. The nurse comes out, "I can't do this throat culture, Dr. G. She's just fighting. Can you do it?" So I do it, and the parent has to hold them and stuff. But right after I give them the popsicle, so they don't think it's not too traumatic for them because they get a reward. And so afterwards you say, "What good strong lungs for you had. Good for you for holding still. That's good job." So they leave with that good feeling. "Oh, he's not yelling at me." And I tell parents, please do not say, "If you cry, you're not going to get an ice cream. You're not going to go to your grandmother's." Say, don't say that. Even if they cry, if we succeed in giving the shot without any injury to anyone, it's good. So what about those kids that develop a true needle phobia? Well, now at Holyoke Pediatrics, we developed a whole clinic around this. And sometimes I would see kids in consultation. I still can for this. And then we go into the history. Often they've had a history of trauma where dad, the big guys, come in and held this 10-year-old down, kicking and screaming. And that's the reason they're so scared. It was avoidable. Okay. No shot. I'm in big favor of getting the flu shot. but no shot is so important, unless they've been bit by a rabid animal and they have to get that rabies vaccine within 24 hours or they die, But generally, no shot is so important. You have to give it right on the spot at that visit. Kids can go and reorganize and come up with a comfort plan and come back. But if they've had that trauma, you have to go through that. And that, you as a therapist know, we go, how have you gotten over other traumas in your life? What have you done? Well, I fell off my bike. That was hard, but I still learned to ride my bike, and so on. We go over going to the Meg Foundation for Pain, coming up with a comfort plan, or we'll talk about misconceptions about, for example, how long a shot takes. How long do you think it takes? Oh, about 2 minutes. I say, oh, really, with the needle in me? And then we'll go through a make-believe shot. Maybe the nurse will give it to me, and I'll time it. Oh, that took 1.5 seconds, So we'll do some reframing around that. Comfort plan. We might talk about anxiety in general. For kids in our office, they might see Patricia, who's one of our therapists, or see me. Now there's a whole clinic called the Fearless Vaccine Clinic for kids in groups to help get over their fears or phobias. And it's been quite successful.
So David, we're almost out of time. And we've touched on some aspects of your book, and I wonder if there are any others that we should talk about, or you'd like to kind of mention, because we've talked about one aspect of it, but it's there's a lot to your book.
Yeah, I'll try to do a really quick vision because that's why it is sort of long. People, geez, 300 and so on pages, over 400, but that's 60 pages of references because I wanted to show this is evidence-based. This is not, just pie in the sky, So anyway, bedwetting is a lot of fun to treat. And is it hypnosis? No. What I basically do is have kids draw pictures and teach their brain to talk with their bladder. It's basically what the bedwetting alarm, which is the proven therapy for bedwetting, does, but I teach kids to use their own alarm. In fact, that's what they eventually do the psychologists talk about the locus of control starts with the alarm. It rings, ring, ring, ring when the pajamas are wet till the children learn to internalize that locus of control inside themselves. So we start with that, and I have kids draw pictures, and that's lots of fun. I talk about the use of mental rehearsal, which you see all the Olympic athletes work. That is a form of guided imagery. I've worked with all kinds of athletes, some of whom had somatic complaints for which they saw specialists with, ringing in their ears, nausea, vomiting, blurry vision, all related to the stress of the being very competitive athletes. We've talked about that, and then I've helped them, as other sports psychologists would do, the same thing. Imagine themselves in their sport, doing everything their coach instructed them. That way, I don't have to be an expert in the sport, and then see themselves succeeding, not just seeing themselves, but feeling themselves with all their senses. I talked about kids on the autism spectrum, how the experts used to believe that kids with autism could not do hypnosis because they not capable of forming relationships with people. That's false. We know now. It's just that kids on the spectrum may do it in different ways and may have trouble finding relationships, but it's just in finding that rapport, which I usually am able to do, and then helping them to use their own strengths to help themselves. Oftentimes, they don't like just imagining things, though. The kids on the spectrum often like the biofeedback program I used, heart math, where you hook up probes and it gives feedback back to their body about what their heart rate is doing and is it in sync with their breathing, and that helps them find, relax around if they're anxious or having trouble with their behavior and so on. It's often quite helpful. So that's just another example in a real shortened version. The quote side effect of that is that I've had a couple of teens who really struggled in school. I'm thinking this one teenage boy, he's in the book, fired by his psychiatrist because he slugged her. She got a little close to him, his boundaries, and he felt bad about that. But she fired him, and I became a psychiatrist. But I taught him biofeedback, and he got to teach me when something went wrong with the computers because I have a learning disability when it comes to computers, and he was able to help me out, and that made him feel pretty proud. So that's something that I've used with some of my older patients on the spectrum, for example.
Great. Well, David, this has been fascinating. And where can people learn more about you, and where can people buy the book, Mending the Body with the Mind?
Okay, well, I have a website. I have a website, Mind and Body Pediatric, mindbodypediatrics.org. And there's links on there to my Instagram, which is Dr. David Gottsegen, and my Facebook is author Dr. David Gottsegen, and I'm on LinkedIn as well. And the book is available from local bookstores if you live in the Valley. Pretty much all of them carry it. And also from thrift books and online, thrift books, Barnes & Noble online, Amazon online, and one other. Anyway, that's enough to me. Yeah.
Great. Well, great. Well, thank you so much for carving out the time to talk to us today. This has been delightful.
Well, thank you for carving out the time to do it. I really appreciate it. What you're doing is really important. So,
Thank you for listening to Your Anxious Child. Please leave us a rating and review in iTunes to help us get the word out. If you'd like to learn more and find additional resources, visit us at edwardplimpton.com.